In this morning's Woman's Doctor, your Achilles tendon is strong, but it's not very flexible. When the tendon stretches too much, it can even become inflamed or even tear. Joining us this morning with more information is Mercy Medical Center Dr. Mark Slabaugh. Good morning.
Good morning. How are you?
I'm well. Thank you so much for joining us this morning.
You're very welcome.
Okay, so when we talk about the Achilles tendon, a lot of people have heard it. They may even know what it is, but for those that don't, what is it and why is it so important?
It's very important because it provides your muscle strength when you're running, jumping, doing all the exercises that we love to do. It's very common to be injured because it is under such high stress, but basically it's the tendon that extends from the calf muscle to the ankle bone and allows us really to propel ourselves forward. And it's been obviously in the news quite a bit because of our Raven star, Jenyne Donaldson, who tore his Achilles just recently.
Yeah, and we talk about a tear. That's really bad. Even, I don't know if other people have felt it, but, your Achilles can get really sore sometimes. Even that really impacts your ability to walk and really do a lot of activities. But what can cause a tear?
So it's basically an eccentric load. When your muscle is going one way and your ankle is going the other way, typically people feel like somebody's kicked them from behind. They turn around and they don't see anybody there. They thought that somebody kicked them, but it feels like a pop. It's very painful in the beginning, but then it actually becomes very less painful, and it's not too painful. So a lot of times people don't go to the surgeon or to their doctor because they think that it's just a sprain and it got better a lot quickly. But if you have felt that, you definitely need to get to the doctor to see somebody.
Now, this is a big one because a lot of fans out there wanting to know what you can do to recover. How long is recovery?
Yeah, unfortunately, this is one of those injuries that requires typically a prolonged treatment. Sometimes it does require surgery. It depends on sort of your activity level. Sometimes it can be treated non-operatively just in a cast. But for those people that do have this tear, it's usually about 9 to 12 months before they'll go back to competitive sports.
We hear a lot about bone health. We hear a lot about muscle health, but we don't really hear a lot about our tendons. Is there anything we can do to keep our tendons strong?
Yes, absolutely. Especially if we are doing a lot of sports, we should be stretching before and after. For the Achilles, you should be doing the Achilles stretches probably for a good 2 minutes before you are participating in any running, jumping, especially plyometric exercises. And then afterwards, you should be doing that. But then during the off season or when you're not participating in those sports, you should be doing a lot of strengthening. So calf raises, heel drops, those type of exercises are very good for Achilles health.
Great advice and great information. Thank you so much for joining us this morning, Doc.
You're very welcome. Have a good day.
You too. If you have any other questions or would like a referral, call 1-800-MD-MERCY.